Hi, I'm Kirsten Parker and I'm student 1. For my first setup, I'm going to be doing a rotary adjustment on a right rotation restriction at T6. My contact point is my piezoform on my inferior hand, which is my right hand. My segmental contact point will be the posterior inferior aspect of the left TVP of T6. My stabilizing hand will be the piezoform of my left hand, contacting the posterior inferior aspect of the right TVP. My line of correction is P to A, I to S, along the 60-degree angle of the sets with a clockwise torque. For my second adjustment, I'll be doing a prone index pillar push contralateral on an RPC5. My contact point is the lateral aspect of the index finger on the inferior or my right hand. My segmental contact point is the posterior aspect of the right articular pillar. Stabilizing hand is the thenar of the superior or my left hand, and it's going to traction cephalad. My segmental stabilization point is the left mastoid posterior inferior occipital rim. My line of correction is P to A, I to S, in line with the plane of the disc with my forearm 45 degrees to the floor. For my third adjustment, I'll be doing a supine hypothenar mastoid push on an RPS. My contact point is the hypothenar of the right hand. My segmental contact point is the posterior inferior aspect of the right mastoid. My stabilizing hand is the calcaneal aspect and fingers of the left hand. My segmental stabilization point is cradling the base of the occiput of the left side. My line of correction is P to A, S to I, right to left. For my fourth adjustment, I'll be doing a seated to supine anterior thoracic on an AI T6. My contact point is the hypothenar, thenar, and distal interphalangeal joints of digits 2 through 5 on the superior hand. My segmental contact point is the posterior inferior aspect of both TVPs of the vertebral segment immediately below the listing. Stabilizing hand is the calcaneal aspect of the inferior hand. Segmental stabilization point is the upper elbow, and my line of correction is P to A, I to S. For my final adjustment, I'm going to be doing a seated digit TVP pull on an RPC5. My contact point will be the left proximal and distal interphalangeal joints of the middle finger. My segmental contact point will be the right articular pillar. My stabilization hand will be the calcaneal aspect of my right hand. The segmental stabilization point will be the inferior tip of the mastoid with slight I to S traction. My line of correction is P to A, slight I to S with clockwise rotation.